everyone. I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eyecare, and welcome to Ask Me, our monthly sessions where I answer your pressing questions about eye conditions. Today's question says, Dr. Mattis, I'm embarrassed by my misaligned eyes. Somebody is on the internet and often avoid looking people in the eye. It seems that people are distracted by my wandering eye, which causes problems with social interactions and makes it difficult for me to get my desired job. I'm over the age of 40. Can anything be done for adults with strabismus? Kindly advise. Now, before I answer the question, let's look into what strabismus. What is strabismus? Strabismus is also known as crossed eyes or squint, and as we in Jamaica say, cast eyes. And it is a misalignment of the eyes, causing one eye to deviate inward toward the nose, and we call that esotropia, or outward, we call that exotropia, while the other eye remains focused. Both eyes do not line up in the same direction. Therefore, they do not look at the same object at the same time. It is particularly common in children, but can happen at any age. Now, as today's question was asked by an adult over the age of 40, I will first discuss the management of strabismus in adults. So let us first look at some of the causes of adult strabismus. It may be of childhood origin. Some persons may have residual strabismus that was present in childhood and never corrected. Certain neurological conditions like stroke, multiple sclerosis, or brain tumors can cause the brain to lose control over eye movements, leading to misalignment. Now, certain medical conditions such as diabetes mellitus, thyroid eye disease, and conditions like myasthenia gravis can affect eye muscle function. Trauma is always in the mix. Now, certain head trauma or complications from eye surgeries can sometimes lead to strabismus. Aging can sometimes lead to changes in the soft tissue around the eyes, causing misalignment. And in some cases, there is no specific cause. So what can be done for adults with strabismus? Now, there are several ways to treat strabismus in adults. Surgery is the most common treatment option for strabismus in adults. Surgery can improve eye alignment and in some cases help restore better depth perception. As with any surgery, there are risks with strabismus surgery as well. And while this is rare, they can be serious. So your ophthalmologist will discuss these risks and benefits of surgery. Eye muscle exercises can be done. It has limited effect, but your ophthalmologist can teach you exercises to help with your focus, to focus your eyes inward. These exercises can help if you have what we call convergence insufficiency. That is, when your eyes do not align properly for close tasks. Your eyes should normally turn inwards when you read, and if it's not turning inwards enough, then you have what we call convergence insufficiency. And that happens to patients. You may see it when reading a lot or doing computer work. Now, prism eyeglasses exists, and a prism is a clear wedge-shaped lens that can bend light rays in a certain direction. It can be attached to eyeglasses or made as part of the lens, and prisms can help some persons with double vision to see one image. Botulinum toxin, which is also known as Botox. Yes, Botox can be used in some cases. An injection of Botox in the eye muscle that is overacting can help treat the strabismus. It paralyzes the muscle that keeps your eyes from aligning properly, and this effect usually lasts for a few months. It is never too late to treat strabismus. You do not have to live with the discomfort and the stigma that is associated with your misaligned eyes, and it certainly helps your confidence as well. So with your ophthalmologist's help, you can be guided to the best treatment for your strabismus. Now, As I mentioned in the beginning, strabismus is common in children and infants. And the treatment in children is similar in most cases to what we do in adults. Now, in addition to surgery, treatment includes eyeglasses. And in some cases, eyeglasses can, over time, straighten the eyes. So if a child has blurred vision due to nearsightedness or farsightedness, they may be straining to see clearly, and this can make the eyes cross or drift apart. And eyeglasses can correct the strabismus in these children. Now, sometimes we can do what we call patching. Now, patching involves covering the better eye to allow the weaker eye to be used more so that you can get better acuity in that weaker eye. So that patching can be done over a period of time, and your ophthalmologist can tell you the specific time that you need to patch the eye. And this is obviously better in children where their eye is developing. So it is not necessarily the best option for adults, but for children, this can work in some cases. As I mentioned before, there is strabismus surgery, and surgery is also done in children to correct the misaligned eyes. Now, strabismus surgery does not replace eyeglasses or patching if these are deemed necessary in children. So your ophthalmologist will help determine the best treatment for your child. Now, can strabismus be prevented? Unfortunately, it cannot be prevented, but early detection is very important. Any change in the appearance of your child's eye alignment, or even if you are not quite sure that there is a change, warrants a visit to your eye doctor for evaluation. And if you're an adult, it goes without saying that you should contact an eye care professional if you notice any issues with your vision or your eye alignment, especially after you have had a stroke or any kind of eye injury. So thank you for watching, and see you next month for our next insightful session. And remember, if you have questions, just drop them in the comment section below.